Most people think grief is supposed to get easier with time. But what if time doesn't heal all wounds? What if your brain is keeping you stuck in grief? And what if you can get it unstuck? If you're grieving right now, I want to express and acknowledge just how difficult of a time this is. And my goal with this video is that I'll give you some insight into grief and hopefully give you some ideas of what you can do. And for those of you who are watching who are not grieving, I'm confident that you'll be able to walk away with something useful from this video. Because when it comes to grief and loss, there's only two types of people: those who've experienced it and those who will. Over the next few minutes, I'm going to cover what is grief, experiences that often lead to a feeling of loss, and the emotional landscape of grief. I'll briefly touch on prolonged grief disorder and PTSD. I'll talk about the role of therapy, and in particular, EMDR therapy can play when it comes to grief, including the 5 ways EMDR therapy helps process and integrate loss. And finally, I'll bust 6 myths about grief that I believe do more harm than good to people who've experienced a loss. I've bookmarked these different sections in the video, so if there's a particular topic that is of interest to you, feel free to skip ahead. And before we get into it, hi there, I'm Ashley Phillips, and I'm a practicing trauma therapist and the founder of the Kelowna EMDR Clinic. If you're new to this channel, welcome. I make content about trauma, my thoughts on private practice, and my favorite therapeutic modality, EMDR therapy. If you're interested in any of these topics, then I encourage you to hit that subscribe button so you can easily find my future videos in your feed. Okay, back to the topic at hand. Grief is a perfectly normal response to a loss of someone or something meaningful, and is experienced as a variety of psychological and physiological symptoms. And while we think of grief as an emotional state that follows the death of a loved one, there are other experiences that can lead to a profound feeling of loss. For example, it's normal for people to grieve the loss of a relationship like their marriage or a deep friendship. Many would-be parents experience grief after a miscarriage or an abortion. Grief is also a common response to a serious health diagnosis or the loss of physical abilities. People can experience grief as a response to loss of career and sometimes even retirement, especially for those who derived a big part of their identity from their jobs. People can grieve the loss of their community because they've moved away, or as an outcome of their choices such as leaving their faith. Losing material things can also lead to grief. One example would be the loss of a family home and your possessions in a natural disaster. Another example would be the loss of your retirement savings because of financial fraud. People experience grief differently, but there are some common emotional, physical, and behavioral symptoms. Emotionally, grief often shows up as sadness and numbness. And that's a pretty stereotypical response. Anger is also a common emotion. For example, being angry at God or the medical system or the driver of the other car or another party you feel is responsible, even if it's yourself. Guilt is another common emotion where a person feels the outcome would have been different had they made different choices. You may find this surprising, but sometimes people feel a sense of relief. For example, this happens when a loved one passes away after struggling with a prolonged illness, and the feeling of relief often can turn into guilt. And lastly, people commonly experience a heightened sense of anxiety, fear, and of course, longing and loneliness. Physically, grief can show up as trouble sleeping, either insomnia or oversleeping. It can also feel like a tightness in your chest and your throat and your stomach, and your whole body aches. And it's normal to feel exhausted and fatigued and lose your appetite, and of course, cry. Behaviorally, grief can show up as withdrawal from others. People can ruminate and fixate on what happened. It's common for people to have trouble concentrating, making decisions, and generally getting through the day. Experiencing loss can lead to questioning the meaning of things and reevaluating their worldviews. And of course, grief can lead to destructive behaviors like alcohol and substance abuse. Losing someone meaningful can be an incredibly traumatic experience, especially if the loss was sudden, unexpected, or layered with complicated emotions. When the brain struggles to process the loss, the memory can remain stuck in its raw, unprocessed state. And under these conditions, your amygdala, which is the part of your brain that's involved in threat detection and emotional processing, can keep your body and nervous system in a constant state of alarm. Following a loss, some individuals may develop post-traumatic stress disorder, PTSD, and or prolonged grief disorder. They are two different things. PTSD is characterized by symptoms of hyperarousal, avoidance, and intrusive trauma-related memories, whereas prolonged grief disorder is characterized by intense separation distress, difficulties accepting the loss, and moving on without the other person, which causes significant distress and disability. And this is marked at the 1-year mark of the person's death. EMDR can be very effective for those who have developed PTSD as a result of the loss. For others with prolonged grief disorder, working with a therapist trained in bereavement can be very helpful, and EMDR can work well in certain cases. I'll do a video on prolonged grief disorder in the future, so if you're interested in learning more, make sure to subscribe so you don't miss it when it comes out. It stands for eye movement desensitization and reprocessing, and over the course of decades, it's been extensively studied and is shown to be very effective at treating various conditions caused by unresolved trauma, such as PTSD and prolonged grief disorder. If you want to learn more about EMDR therapy, you'll find some useful links in the description below. One is to a video that provides an overview of the therapy, and another is a series of videos where I go into much greater detail describing all 8 phases of EMDR therapy. I encourage you to check them out. EMDR therapy can help you process the loss in 5 ways. First, it helps to process the traumatic aspects of the loss. Let's say you lost a loved one, and leading up to their eventual passing, there was a frantic 911 call, a chaotic trip to the hospital, and several resuscitations. These specific memories can be extremely distressing and replay intrusively. EMDR targets these memories directly and helps reduce their emotional intensity. Next, EMDR can help by releasing guilt and regret. Guilt is often accompanied by thoughts of, like, I should have said this or I should have done that. And these loops can be relentless. EMDR helps examine and process these beliefs so they no longer carry the same emotional weight. Third, EMDR can help you work through complicated relationships. This is particularly the case when the relationship with the deceased was challenging. Maybe it was abusive or strained or unresolved in some way. And grief can become layered with anger, relief, and shame. EMDR creates a safe place to process all these emotions associated with the loss, not just the acceptable ones. Fourth, EMDR can reduce emotional reactivity to triggers. Following a loss, certain images, smells, sounds, and places can be emotionally triggering, taking you right back to that difficult and emotionally charged time. EMDR helps to desensitize these triggers so they become less disruptive and easier to manage. And lastly, EMDR therapy can help you reconnect with positive memories. Sometimes the pain of grief blocks access to meaningful or comforting memories. And as the distress decreases, EMDR can help restore connection to those memories, allowing the relationship to be remembered with more warmth and less pain. The last thing I want to do in this video is to bust some myths about grief. So myth number 1, grief is only about death. This is incorrect. Like I said earlier in the video, grief is a normal reaction to a loss of someone or something meaningful. And the key words here are loss and meaningful. Let's not invalidate someone else's feeling of loss just because no one died in their life. Loss can be of a long-term relationship, loss of physical ability, loss of identity, loss of career, and other examples that I shared with you earlier are all very legitimate reasons to grieve. Okay, myth number 2, grief happens in stages. Totally incorrect. You've heard about the 5 stages of grief being denial, anger, bargaining, depression, acceptance, and now a 6th stage, meaning. There is this tendency to think that these move in this orderly, linear fashion, and that's completely misunderstood. In reality, people's experience of grief is very individual and hardly orderly. Instead, they are patterns that many people move in and out of as they process grief. People can jump around, they can return to a stage, and they can skip a stage altogether. Stages may overlap. It's also possible to get stuck and develop prolonged grief disorder or PTSD, as I mentioned earlier. Moving on to myth number 3 is you should be over it by now. When it comes to grief, there is this societal pressure to move on. Typically it's like the 1-year mark that it's time to get over it. But as I've said, grief is very individual and there's no universal timeline. Let people grieve on their own terms without applying the pressure of timelines. And we learn to live with grief, not get over it. Myth number 4, if you're not crying, you're not grieving. I keep returning to this point that grief is a highly individual experience. And much like there's no universal timeline, there's no one way that people experience grief. Yes, there are common physical, emotional, and behavioral symptoms that I went over earlier, but common does not mean universal. Some people can appear very strong and stoic and functional, and yet experience a profound sense of loss and pain. So just because someone doesn't look like they're grieving doesn't mean they are not. Okay, myth number 5, grief is something to be overcome. I believe that seeing grief and loss through the lens of something that needs to be conquered and overcome is fundamentally flawed. Grief is not something you will just finish with one day, but instead the loss is something you learn to live with and carry. Yes, people overcome the more acute symptoms of grief, but it's perfectly fine for the deeper sense of loss to persist. And I believe it's more helpful to look at grief through a lens of meaning and integration rather than resolution. And finally, myth number 6, time heals all wounds. Except it doesn't. Not really. Time helps numb and dull pain and the symptoms of grief, but time on its own is not a sufficient ingredient to achieve that meaning and integration I just talked about. It's what you do with your time that matters. This is where therapy, support groups, connection, and community can be an excellent tool in helping you navigate grief and mourning. The sooner that we as a society can stop perpetuating these myths about grief, the better. Loss is hard enough, and it's not helpful to layer on doubt or concern whether your grief is appropriate. So, which of these myths do you find is the most damaging? Let me know in the comments below. And if you think there's other myths of grief that I missed, leave a comment and share what they are. I'd love to know about it. Well, I hope you found this video useful. If you know someone who's grieving, please feel free to share this video with them. My hope is that something I said in this video will be helpful or reassuring to them. And if it's you who are currently grieving, there are many supports out there. David Kessler and Dr. Alan Wolfelt are experts in the field, and they both offer great support, both free and for a fee for people. Your local hospice may offer support groups and therapy, and there's many therapists who specialize in grief counseling. If you've made it this far, do me a favor and give this video a thumbs up as well as help others find this information. And if you haven't already, hit that subscribe button so you don't miss out on any of my future videos. Until next time.